Hey everyone, and welcome to the show. It's kind of a heavy question, but have you ever stopped and thought about whether some lives in America are just seen as less important, less valuable?
That's a really powerful way to put it.
Yeah, and that's kind of the difficult topic that we're going to be exploring today, this feeling that for some people the system isn't just failing them, it's actually working against them.
Right.
And the book that we're diving into today really dives headfirst into this topic. It's a work of nonfiction investigative journalism and social commentary, and it's called
Disposable Americas. Contempt for the Underclass.
Yeah, so if you're ready to look at some uncomfortable truths about American society, then stick with us. And if you find this deep dive interesting, please hit that like and subscribe button. It helps us bring you more deep dives like this one.
And you can find a link to the book in the description below.
Right.
And what I find so interesting about this book, right from the start, is how this feeling of being undervalued or overlooked isn't just about bad luck. It's not just about individual circumstances, as Sarah Jones argues in Disposable Americas. It's often a direct result of the policies and systems that have created and maintained inequality in our society.
Exactly. We're not just going to sit here and summarize the book. We really want to understand what's at the heart of her argument and what it means for you, the listener.
Right.
And the central thesis as we see it is that for a lot of people in America, hardship isn't just some random thing. It's actually a predictable outcome of choices that are made.
Right.
Jones argues that there's a segment of society that she calls the ruling class that has historically benefited from and even created economic insecurity for those who have less power.
And what's even more striking is how the COVID-19 pandemic didn't just highlight these existing inequalities.
Right.
It made them so much worse.
It magnified them.
It magnified them, exactly. And that really feeds into this concept of social murder, which Jones discusses in the book.
Oh, yeah, that's a powerful term.
It is a powerful term. And when you hear it, you might think of, individual acts of violence,
Right.
Like a crime. Exactly. But she's using it in a much broader sense to argue that the way our society is structured and the decisions that our leaders make can actually lead to preventable deaths on a massive scale.
Yeah, it's not just one person harming another, it's the system itself.
Right. And the pandemic for her becomes a really tragic example of this in action.
Wow.
In the book, she says, for too many people, misery is the formal policy of the United States.
That's a powerful statement.
It is a really powerful statement. And for you, the listener, this idea really challenges you to think about how neglect at a systemic level can have fatal consequences.
It's not just about individual actions, it's about the systems that are in place.
Exactly.
So let's look at some specific examples of this disposability that Jones highlights in the book, starting with the story of John.
Yeah, John's story is really interesting because it shows that this feeling of anxiety and disconnect wasn't limited to people who were traditionally considered marginalized.
Okay.
So we have John. He's a white, relatively well-off civil servant.
Got it good.
He's doing okay, but he's facing the uncertainty of the pandemic, and he finds himself drawn to these right-wing narratives that downplay the virus and dismiss public health measures.
So he's buying into a certain ideology.
He is buying into a certain ideology, and even though he lives with his elderly mother, putting her at risk, he embraces this individualistic mindset.
He's not thinking of the collective good.
Exactly.
Yeah.
So you can see how narratives of individual freedom and responsibility can sometimes override even self-preservation.
Right, and that can have an impact on others around them.
Absolutely, regardless of socioeconomic status.
So it's not just about personal beliefs, it's about how those beliefs can affect the well-being of others.
Right.
Now let's contrast that with the experience of Courtney Brown, who worked at Amazon Fresh during the pandemic.
Courtney's story really brings to light the dangers that essential workers were facing.
Right. These are the people who couldn't just stay home.
They couldn't stay home. They had to keep going to work, keep society running, and they also didn't have adequate safety measures in place.
And the demand for their work actually increased, right?
Absolutely. As more people stayed home, the demand for deliveries and groceries and other essential services skyrocketed.
But there were fewer workers.
Exactly. Courtney herself talks about this huge decrease in workers because people were afraid to get sick or to bring the virus home to their families.
So they were in a really difficult position.
They were stuck between a rock and a hard place.
Yeah, they were deemed essential, but their safety wasn't always treated as essential.
Exactly. That's the key takeaway here. These workers were considered vital for the economy to function.
Right, society needed them.
But their own health and safety weren't always given the same level of importance.
And that's a form of disposability in a sense.
It is. It's saying that these lives are expendable for the sake of convenience and profit.
Now, Jones also shares a very personal story in the book, The Story of Her Own Grandfather, and his journey really highlights how insecure aging can be in America.
It really does. His story is a perfect example of the challenges so many seniors face. And it started even before the pandemic. His wife's cancer treatment put a huge financial strain on them.
Of course.
And they actually lost their health insurance for a while.
Wow.
And then they had to navigate the really confusing world of Medicare Advantage.
Which can be tricky.
It can be so tricky, and there's a real potential for scams and limitations on care.
Yeah, you have to be careful.
And what's especially troubling is that United Healthcare seemed to deny him necessary rehab care based on cost, not on medical need.
Oh, wow. So they were putting profits ahead of his health.
That's the implication. And tragically, his story ends with a COVID-19 outbreak at his nursing facility.
It's just heartbreaking.
It really is. And it just underscores how easily the most vulnerable among us can be swept aside during a crisis.
Even with a loving family supporting him, they were up against a system that didn't seem to have his best interests at heart.
That's right.
And then there's the story of Anna Mae Morris, a Choctaw and Obizuria woman who worked in a low-wage job and sadly passed away from COVID.
Anna Mae's story is a tragic reminder of the unequal impact the pandemic had on marginalized communities.
Yeah, it wasn't a level playing field.
It wasn't at all. People in these communities were already facing a higher risk of exposure because of the types of jobs they had and because of historically limited access to good quality health care.
So the pandemic just amplified existing inequality.
Exactly. It's like shining a spotlight on the disparities that were already there.
And those disparities aren't random. They're the result of systemic issues.
Precisely.
And it's also important to talk about this concept of eugenics, which resurfaced in a really disturbing way during the pandemic.
It's unsettling, isn't it? This idea that some lives are just seen as less valuable.
Yeah, it's like going back in time.
And Jones reminds us that forced sterilization was a real thing in this country not that long ago.
Wow, I didn't know that.
And it wasn't until relatively recently that people with disabilities were given federal civil rights protections.
So this pandemic, in a way, brought these old prejudices back to the surface.
It did, and it makes you wonder how much progress we've really made.
Yeah, and this connects to the story of Bobby, who passed away from COVID in a nursing home.
Bobby's story raises a lot of questions about accountability in these facilities.
Right, especially during a crisis.
His sister Deborah believes there was negligence.
Really?
She says Bobby's roommate had COVID, and then they put another roommate in the room who also had COVID.
Oh, wow.
It's very concerning, and Deborah feels strongly that if Bobby had had more money, he would have received better care.
So again, we see this connection between socioeconomic status and access to quality care.
Exactly, and that's a disturbing thought that your wealth could determine whether you get the care you need.
It's just not, right?
It's not.
Now, in contrast to Bobby's tragic story, we have the story of Melody and Joe, an elderly couple whose love story was cut short by the virus.
Melody and Joe were living in an assisted living facility,
Okay.
and they had been together for 15 years.
Wow.
And when the pandemic hit, they were separated because of the safety measures.
That must have been so hard.
It was. And Melody was so determined to say goodbye to her husband one last time.
Oh, wow. That's so touching.
It really highlights the personal tragedy that were happening behind the statistics.
Yeah, the pandemic didn't just affect physical health. It affected relationships and people's futures.
And it hit those who were already vulnerable the hardest.
Now let's talk about the political response to the pandemic, which was very divided, shall we say.
It was incredibly polarized. You had different groups reacting in very different ways.
It seems like everything became political.
It did, and you can see this in how different media outlets and political figures framed the situation.
Okay, give me some examples.
Well, for instance, you had the Wall Street Journal actually defending Haredi protests against lockdowns.
Really?
Yeah, and then you had Republican figures like Trey Hollingsworth and Rand Paul downplaying the seriousness of the virus.
So they were kind of minimizing the threat?
They were, and they often framed public health measures as attacks on individual liberty or threats to the economy.
So it became this ideological battle.
It did, and for some, it seems like economic concerns were given priority over the very real dangers to people's health.
And this political climate had a direct impact on essential workers, right?
Absolutely, especially those working for companies like Amazon and Kroger.
Yeah, these companies were making record profits.
They were, while their employees were facing increased risks, often without proper protection. And many didn't even have paid sick leave.
Which is pretty unbelievable when you think about it.
It is, and the Economic Policy Institute reported that a significant percentage of low-wage workers didn't have this basic safety net.
So they were basically forced to choose between their health and their livelihood.
Exactly. And you see this stark contrast with Kroger, for example, where workers were facing food insecurity while the company was making huge profits and the CEO was getting a massive compensation package.
It just shows how profit can sometimes be prioritized over the well-being of the workers.
And that's a theme that runs throughout the book.
But it's not all doom and gloom. Jones also highlights some inspiring examples of worker resistance.
Yeah, there were definitely glimmers of hope. Well, there's the story of McDonald's workers who were reportedly given dog diaper masks as PPE.
Wow, seriously?
Yeah, and then there were the Starbucks unionization efforts.
Where workers were demanding better treatment.
Exactly. They were fighting for their dignity and their safety, especially after seeing how their employers handled the pandemic.
So they were taking a stand.
They were, and it shows that even in the face of these challenges, people can come together and demand change.
And the book also talks about nursing homes and the role of private equity in elder care.
Yeah, this is a really important issue that Jones dives into.
Because it seems like there's a conflict of interest there, right?
There is the drive for profit can sometimes clash with the needs of the residents.
And there's data to support this.
There is research has shown that private equity investment in nursing homes can actually lead to worse outcomes for residents.
Like what kind of outcomes?
Things like reduced staffing, which then leads to lower quality care and even higher mortality rates.
Wow, so it's a life or death situation.
It can be. And Jones's own grandfather's experience in a nursing home that had a major COVID outbreak really highlights this issue.
It's a reminder that profits shouldn't come before people's lives.
Especially when we're talking about vulnerable populations.
And then we have the story of Anna, whose transfer to a hospital was delayed, and whose sisters couldn't even be with her at the end because of COVID.
Anna's story is just heartbreaking. It shows how the pandemic really strained the healthcare system and left many families feeling helpless.
They couldn't even say goodbye.
It's a tragic example of how the system failed to protect the most vulnerable.
But it's not all negative. The book also talks about groups like Seniors and Disability Action SDA who are advocating for change.
SDA is doing some really important work fighting against ageism and pushing for a more inclusive society.
So they're giving a voice to those who are often overlooked.
Exactly. And they're reminding us that vulnerable populations aren't just passive victims, they're actively fighting for their rights.
And that's important to remember.
It is.
Now, another issue that Jones explores is the rise of the anti-vaccine movement and its connection to right-wing ideologies.
This is a complex issue, but it's clear that anti-vaccine rhetoric became increasingly aligned with certain political viewpoints.
Right, it became part of a larger narrative.
Exactly. And this often involved downplaying the severity of the pandemic and putting business interests ahead of public health.
So it was more than just about vaccines, it was about a whole worldview.
It was. And this could have serious consequences for vulnerable people who rely on herd immunity for protection.
Right, their health depends on others getting vaccinated.
And the idea that vaccines are somehow a threat to individual liberty is a powerful example of this rhetoric.
It's a very individualistic perspective.
It is.
And then there's the issue of racial disparities, which were really brought to light during the pandemic.
The data is undeniable. Black communities and other marginalized groups were disproportionately affected by the virus.
They had higher rates of infection, hospitalization, and death.
And this highlights the deep-seated structural inequalities in our society.
It's not just a coincidence.
It's not factors like higher rates of homelessness, substandard housing, and unequal access to health care all contributed to these disparities.
And Jones argues that structural racism is at the root of this.
She does, and it's a crucial point to understand.
Yeah, it's not just about individual prejudice, it's about the systems that perpetuate these inequalities.
Exactly.
But there were also some positive efforts to address these racial disparities.
Oh, absolutely. There were people working tirelessly to make a difference.
Like who?
Well, there was Nolan's We Got Us initiative, which was all about promoting vaccine confidence in Black communities.
Okay, so they were trying to build trust.
Exactly. And then there's Mejia Gonzalez, who's doing amazing work addressing the social determinants of health.
So they're looking at the bigger picture, the underlying factors that contribute to health disparities.
Right. And these are just two examples of the many people who are working to create a more equitable healthcare system.
And it's important to highlight those efforts. Now, Jones also connects the pandemic to the social justice movement that emerged after the murder of George Floyd.
She argues that the pandemic exposed the disposability of certain populations in a way that many people couldn't ignore.
Right. It made it impossible to look away.
Exactly. And this heightened awareness likely contributed to the massive protests and the calls for social justice.
So the pandemic, in a way, created a context for a broader conversation about inequality.
It did. It forced us to confront the ways in which our society devalues certain lives.
And that's a conversation that needs to continue.
Absolutely.
Now, another major theme in the book is healthcare access and affordability.
This is a huge issue in the U.S., and the pandemic really brought it to the forefront.
People were losing their jobs and their health insurance.
Exactly. And Jones shares some really powerful stories about the human cost of this broken system.
Like the story of Smith, who died because he couldn't afford to go to the emergency room.
That's a tragic example of how our healthcare system can literally be a matter of life or death.
And then there's Vic, who lost his job and his health care during the pandemic.
And his story highlights the precariousness that so many Americans face. They're one job loss away from losing their access to healthcare.
It's a very fragile system.
It is.
And even those who have insurance can face huge financial burdens.
Right. Jones talks about Pollyhausen, who had to pay exorbitant costs for a medical device, even though he had insurance.
So insurance isn't always a guarantee of protection.
It's not, and these unexpected costs can be devastating for families.
It's like a hidden cost of healthcare.
Exactly.
And Jones also discusses the Affordable Care Act, the ACA.
She acknowledges the positive impacts it's had, like expanding coverage and protecting people with pre-existing conditions.
Right. It's been a significant step forward.
But she also points out its limitations.
Like what?
Well, she talks about how she still relies on employer-sponsored insurance and how this ties healthcare to employment.
Which can be a problem if you lose your job.
Exactly. And she argues that we need more fundamental reform to truly make healthcare a right, not a privilege.
It's an ongoing debate.
It is, and a really important one.
Now, the book also delves into the concept of healthcare rationing.
Which is a controversial topic.
It is, and Jones makes a distinction between implicit rationing, which happens in the U.S., and explicit rationing, which is more common in other countries.
Right. In the U.S., we don't have these so-called death panels that people talk about.
But we do have a system where care is often rationed based on ability to pay.
Exactly. And this can have just as devastating consequences as explicit rationing.
So it's a hidden form of rationing.
It is. And the ProPublica recording of United Healthcare denying treatment is a chilling example of how this plays out in real life.
It's all about the bottom line.
It seems that way sometimes.
And the book also touches on the political battles surrounding healthcare.
Yeah, like the fight against the AHCA and the push for Medicare for all.
These are really important debates.
They are, and they highlight the fundamental disagreements we have about the role of government in healthcare.
Should it be a right or a privilege?
That's the question. And research suggests that a system like Medicare for all could have saved countless lives and billions of dollars during the pandemic.
So it's not just a philosophical debate, it has real-world implications.
Absolutely.
Now, when we compare the U.S. to other developed countries in terms of pandemic response, the results are pretty shocking.
The U.S. had a much higher COVID-19 mortality rate than many other wealthy nations.
And that's not just bad luck.
It's not factors like low vaccination rates, and our for-profit healthcare system likely played a significant role.
So our system is failing us in a way.
It's not performing as well as it could be.
And the pandemic was especially hard on the unhoused population.
Absolutely. They were incredibly vulnerable.
And Jones shares the perspective of Perez, who talks about the dehumanization that unhoused people experience.
Perez's account is a powerful reminder that we need to see the humanity in everyone.
Even those who are living on the streets.
Especially those who are living on the streets. They're often ignored or treated as invisible.
And the tragic killing of Jordan Neely really highlights this.
His death and the reactions to it revealed how easily we can dehumanize people, especially those who are unhoused or struggling with mental health issues.
Like a wake-up call.
It is.
And then there are the incarcerated individuals who faced really harsh conditions during the pandemic.
Prisons and jails became hotspots for the virus.
Because of overcrowding and lack of sanitation.
Exactly, and they often didn't have access to basic protective equipment.
It's like they were forgotten.
And Aquira Stanley from AFJ talks about the fear and suffering that incarcerated people and their families went through.
It's a reminder that even those who are incarcerated deserve basic human dignity.
Absolutely.
But there were also some positive efforts to protect the unhoused during this time.
Yeah, the Boston Healthcare for the Homeless program, BHCCHP, did some really important work.
They provided healthcare testing and isolation for unhoused individuals.
They were a lifeline for so many people.
And that's an example of what's possible when we prioritize human dignity and public health.
Yeah.
And Jones also talks about the societal desire to just move on from the pandemic.
There's this sense that we just want to forget about it and go back to normal.
But that's not possible for everyone.
No, there are so many people who are still grieving and struggling with the long-term effects of the virus.
And groups like Marked by COVID are working to ensure that the lives lost are not forgotten.
They're pushing for a national COVID Memorial Day.
So we can collectively remember and honor those who are gone.
And it's important to recognize that grief needs to be validated.
People need to feel seen and heard.
Exactly.
And finally, the book highlights the plight of excluded workers like undocumented immigrants who were left out of pandemic relief measures.
These workers were essential to our economy, but they were denied access to the support that others received.
It's a huge injustice.
It is, and organizations like the National Day Laborer Organizing Network and the Lawn are fighting for a more inclusive system.
They're advocating for things like the Unemployment Bridge program, so everyone can have a safety net regardless of their immigration status. So the COVID-19 public health emergency may be officially over.
But the issues that it exposed are still with us.
Inequality is still a major problem.
And we need to learn from the mistakes that were made.
We can't just go back to the way things were.
The pandemic has changed us, and we need to build a more just and equitable society.
So as we wrap up this deep dive into Disposable Americas, we have a question for you, the listener.
What are your thoughts on the pandemic's impact on social inequality?
And what does it mean to be disposable in America?
We'd love to hear your reflections in the comments below.
And don't forget to like and share this deep dive with anyone who might find it interesting.
Thanks for joining us.
And we'll see you next time.